abnormal mental health, and I just found it really fitting for this kind of assignment to see similar work being done even, a year or a couple years after Churchill's death. After a bit of investigating and research for this project, I best found and believed that Winston Churchill might have been suffering from bipolar type 2 disorder, most specifically because of accounts made by his wife. According to different journals and letters, Churchill presented with some of the many common sides of hypomania, including decreased need for sleep, a hyper focus on certain projects, whether that be his political projects or his personal ventures, sudden racing thoughts and ideas, and he would kind of just go into this hyperdrive of waking up really early for work. He would leave and he wouldn't come back till 2 or 3 in the morning, and his wife would recall instances where this would happen for quite a few couple weeks at a time, followed by really low periods of him not wanting to leave the house at all. And I think that's important to note because this hypomania is not his baseline. This is definitely an exasperated account of his emotions and his behavior. This is not his normal for him. And on the opposite end of that spectrum was his depressive episodes. One of the biggest things that, of course, is associated with Churchill is his use of the phrase black dog to describe his depressive or down episodes. I found it really interesting, actually, because I always associated him with the first person to ever use that word or that phrase, but he actually was not the first. Despite that, there were multiple times in letters personally written to his wife, including 2 samples I found from 1911 and 1916, where he specifically mentioned using the phrase black dog, where he would look back on depressive episodes after his mood stabilized, and he would note feelings of sadness, of losing interest in certain passions, and even at point in times express possible unwanted suicidal thoughts, even to the point where he would refuse to go out on balconies or step too close on subway or train platforms because of fear of what may happen if he got too close to the edge. I think this is a pretty accurate representation of what somebody with bipolar type 2 may be diagnosed with. Of course, it requires a little bit greater look at what their baseline and their typical mood looks like compared to these low depressive episodes and these manic episodes. It also requires a greater look at how frequently and how long these different severe episodes are lasting. However, based on the back and forth and the overall discourse surrounding Churchill and all the third-party accounts of his behavior, I think bipolar type 2, based on the DSM-5 criteria for it, fits his symptoms quite well. Now, in regard to treatment during the time he lived in, a lot of the options available to Churchill were kind of some of those baseline mental health treatments. Honestly, a couple of them similar to what we see now, just a little bit less progressed science-wise. One of the biggest ones for them during that time was physical rest, which Churchill often cites participating in whenever he was in depressive periods. There was also medications like lithium, which is also still a common one today, and more invasive therapies like electroconvulsive therapy. Notes and medical documents from his doctor often mentioned the doctor prescribing him medications to help clear his mind before big speeches or in times where he desperately needed rest and couldn't get it on his own. Looking at treatment in modern times, if he was a patient of mine, I think a combination of mood stabilizing medication and a CBT would be the perfect fit for Churchill. Throughout the research I was doing, he himself and third-party accounts placed a lot of emphasis on how he would find different ways to lean into healthier outlets to help him through his depressive episodes, whether that was his art or that was writing or that was resting. Sometimes he would seclude himself a little too far, but he always ended up coming back to find more healthier outlets to work through his different highs and lows. Finding a way to stabilize his mood with some assistive medication and then tapping into Their coping options through cognitive behavioral therapy, I think, is the best route to go for him, and of course many other people with bipolar type 2. Even with the therapy and the different types of assistance that were available to him during his time, he was obviously still quite very successful despite his disorder and his difficulties maintaining his mood. But I think there was a lot of evidence that also supported his constant exhaustion and frustration from his high highs and his low lows. One of the biggest things I think with Churchill being able to overcome adversities and being able to work past his abnormal mental health was that he tried his best to be open about it. He tried his best to share his wavering mental health and his difficulties processing it with people close to him, and I think that helped him immensely, more than if he was entirely secretive about it. He wasn't 100% as far as sharing it, and I think a lot of the times reading back on his personal letters and journals to himself and to his family, he wasn't quite sure what he was dealing with, and there was kind of a sense of maybe fear, but just lack of understanding for the different changes in his emotions that made it difficult for him to process and overcome his lows sometimes. But I think him willing to be more open about it was definitely a change as far as the mental health scene went, and allowing him to actually process through those different emotions. He struggled a lot, however, still, from childhood into adulthood and throughout his entire life to death. He struggled with personal relationships, and there were so many different journal entries of his where he spoke on that, having a hard time maintaining relationships with even his closest family, like his wife, and even down to his friends and political relationships as well. I think one of the biggest components, as I had kind of stated, that helped Churchill process his abnormal mental health was his use of art and writing as an outlet to put out his thoughts. He was very open as well in his journal entries about the way he used painting to help him overcome his depressive episodes. He even loved it so much and utilized it so much that he went on to build his own painting studio in his home with his wife because of how great of a coping mechanism painting and art became for him. And over the course of his lifetime and posthumously as well, his literary works equaled to about, give or take, 43 books in length and word count wise, which I think is such a large amount of work and really goes to show how much he loved writing, how much he loved history and politics, and being able to pour that out in a more physical way. Despite his bouts of severe depression and his early struggles in education and his setbacks politically, I think it really is obvious how much of a lasting impression Churchill left with the people in the political scene and even in his personal life. If I were to be a friend or maybe a colleague or a family member of his, I definitely think his mood changes and his instability would be noticeable. However, I think he really presented with good coping mechanisms and ways to help himself process through the different changes in emotions and how he felt. And while it is a noticeable difference to the people that are close to him, I really think the best way to have helped him process through that was just to be a sounding board and to be a shoulder to lean on. I think a lot of his lack of personal relationships just came from not knowing how to approach people or how to maintain those steady connections when he was in his depressive episodes or when he was having a hard time or struggling. And therefore, I think really all it would take, if I were to have known him more personally or even more in an acquaintance way, would just to make myself known to him and to always be kind of a present person regardless of if he needed somebody or not. I think that also kind of circles back to his lack of emotional connections with his parents and being unable to form those necessary emotional bonds that he needed when he was little. Overall, based off of the research I was able to compile and the different accounts I was able to look at as far as Churchill and his behavior, I do think he presented with some form of abnormal mental health or like I said, bipolar type 2 disorder. However, based off of everything, and as he's known for his reputation and all of the different things he had accomplished in his personal life and his career, that's obviously not something that stopped him. And I think that really goes to show that no matter what, even if you're somebody that may be dealing with abnormal thinking, or you may fall on the spectrum of some form of mental health disorder, that you can still accomplish big things and you can still go on to lead quite a successful life. Thank you.